Hi, Medicare Dana here. In this video, I'm going to go over the different parts of Medicare. So I'm going to go ahead and share my screen. And if you want to grab pen and paper, I would recommend that you watch this, jot down any questions that you might have. Feel free to call me. We can go over any of this in more detail. But basically, there are four parts of Medicare. Your Part A, which is the hospital coverage. Part B, which is your doctor coverage, Part C, which is Medicare Advantage, and Part D, which is your prescription drug plan. Now, with Original Medicare, which is Part A and B together, you have an option to get a supplement plan. Here are the parts of Medicare described in the Medicare Guidebook, Medicare and You 2021. This is a fantastic tool and resource that anyone who's on Medicare should have easily at their fingertips. You can get it online at medicare.gov or on my website, medicaredana.com. Part A is going to be your hospital insurance. That's going to cover any time you are admitted to a hospital, skilled nursing facility care, hospice care, or home health care. Now, this is when you're admitted to the hospital. So if you are at an emergency room and you get observed but not admitted, that would not be your Part A hospital insurance coverage. Part B is going to be your medical insurance and what some people like to call everything else, everything outside of that hospital insurance. This covers doctor's visits, facilities, outpatient care, home health care, durable medical equipment. This is going to cover lab services, ambulance care, and some preventative services. Part D is going to be your prescription drug coverage. And these three parts together are considered Original Medicare. When you have Part A and Part B, that's Original Medicare. And then you get a standalone drug coverage program, which is Part D. Medicare Advantage is going to be your Part C. Now, Medicare Advantage is an alternative to Original Medicare. You can opt out of the Original Medicare federal program and join a Medicare Advantage plan. A Medicare Advantage plan is going to be a managed care type of a program where a private insurance company is going to be dictating who you see, what type of services that you get, like an HMO or a PPO. And with the Part C Medicare Advantage plan, they typically bundle your Part A and B and sometimes Part D services. Now, digging a little bit deeper, Original Medicare, which is that Part A and Part B, has a different program than the Part C Medicare Advantage. So I want to just highlight this so that you can have a good understanding. Original Medicare is nationwide coverage. So we are all pretty much used to individual or group plans that have an in-network, out-of-network component. With Original Medicare and what you've bought into is this freedom of choice. There are no networks. So you choose the doctor, you choose the facility, you choose the locations. It's guaranteed renewable. So what that means is that as long as you're paying your premiums, you will be guaranteed for life. Now, this Original Medicare is accepted by 96% of doctors and facilities nationwide. It is the most widely accepted insurance program in the U.S. And when I say you choose your doctors, you choose your facility, that's tied to that. There's, 96% is a huge percentage. And with Original Medicare, there's no referrals. There's no need for pre-authorizations. If you have to see a specialist, if you have to go to the Mayo Clinic, for example, you have that opportunity and you don't need to get any type of pre-authorization. Original Medicare, you can change at any time. There's no lock-in time period. With Part C, Medicare Advantage, there's a bit of a different program rules and guidelines. Medicare Advantage is going to be county specific, so you're going to have more of a restricted network of providers. There are some Medicare Advantage plans that are PPO, but they're still going to have that in-network, out-of-network opportunity and option versus having no networks at all. You do need referrals and pre-authorizations for a Medicare Advantage plan. The co-payments and the deductibles are typically higher with Medicare Advantage. Now, something I should have said earlier is that with Original Medicare or Medicare Advantage, either program that you choose, you still have to pay your Part B premium. So Medicare Advantage might be a little bit less money each month for that supplement, but you're paying more on the back end with copays and high out-of-pocket costs and deductibles. The doctor might leave the plan at any time, or the hospital, and the plan can be canceled. You would then have to find new insurance. It is not guaranteed renewable. And there is a lock-in period, so there's one time of year each year that you can make changes to your plan. Here in that Medicare and You guidebook, there is a chart that shows the differences between Original Medicare and Medicare Advantage, highlights that with Original Medicare, you can go anywhere in the U.S. Medicare Advantage has that restrictive service network and whatnot. Now, the supplement plans with Original Medicare fall under the same exact guidance and guidelines as Original Medicare. So it's going to be no networks. You choose the doctor and facility. It is, as widely accepted because it's that same program as Original Medicare. So 96% of doctors and facilities accept it. You're guaranteed renewed for life. No referrals are needed. It's standardized. And what that means is that across the board, in any state that you're in, as long as you are on the supplement plan, your coverage and your benefits are the same. So if you're in Illinois or Texas or New York or Georgia, and you have a supplement plan that's the same as another friend or family in one of those states, you have the exact same coverage. That's what it means by being standardized. Now, the insurance companies, however, can charge varying premiums for that same exact plan. And that's why it's really important to work with an independent agent who can shop the full market and be really transparent about those costs. But very good for you to know that when you're looking at supplement plans, if that's the route that you choose, you want to look at all the different options, because it's not the insurance company that dictates the coverage or the benefits. It's the federal program, but the insurance company will dictate the price. So you want to look at all of your options so that you know as a consumer where you can get, or save the most money, but still get that high-end coverage. And you can change your plan just like Medicare, Original Medicare, at any time. Those are the 4 parts of Medicare. Part A, Part B, Part C, and Part D, and then, of course, that optional supplement plan. For any questions to review any of this in further detail, please call. I am happy to help you, to assist in any way that I possibly can. And for more information, there's a lot of other videos on here, hopefully helpful, that you can look into, write down your questions, and give me a call, MedicareDana.com. Thanks.